Good morning, everybody, and welcome back to the Funky Brain Podcast. My name is Dennis, and this is my Funky Brain. And today's episode is brought to you by MZ Electric, the #1 electrical service provider in the Denver metro area. How important is your peace of mind? Your home is your greatest purchase you're ever going to make. MZ Electric techs are licensed, background checked, and highly qualified to help you maintain the highest safety standards for your family. Whether you want to update your electrical panel, install a hot tub, update your fixtures, or remodel your basement or kitchen, MZ Electric will walk you through the process, provide competitive prices, and get the job done right the first time. With more than 30 years experience, MZ Electric has been proudly serving Colorado with exceptional value for more than a decade. MZ Electric, 303-933-9220 or mzelectric.com. So our guest today is the Medical Director for Seabrook, our country's leading addiction treatment facilities, based out of Bridgeton, New Jersey, Dr. David Russo. How are you today, sir?
I'm good. How are you?
I'm doing pretty awesome myself. How long have you been in this field, and how did you come to end up at Seabrook Treatment Center?
Well, it's an interesting story. I'm in recovery myself. My training is in surgery. I was a practicing surgeon for many years, and then I went back to surgery after after I got treated and my recovery started. So I was a successful surgeon, but I started developing pretty significant neck problems, so I couldn't really operate anymore. So I quit surgery, and I called the guys at that treated me in my rehab 12 years earlier. They remembered me, which may be a bad sign. I don't know. And they said, well, we have a fellowship now. It's ACGME accredited. Come here and do the fellowship for a year. So I went and got specialized training, board certification. And that was 2 years ago. So I've been out for a year. So I'm still, wet behind the ears with it, but it's gone really well so far. My life is so much better.
Yeah, that's great to hear. Well, and for those that are listening, the reason I reached out to Seabrook to have Dr. Russo on the show is that, most of you know I'm a coach for addiction recovery and alcoholism, and I work mostly with men. And I want people to know that I believe there are multiple ways to become clean and sober and drastically change your life. And I work with people suffering from different types of addictions as well. But my approach and my practice is rooted mostly in digging into the subconscious mind and altering beliefs and behaviors, and developing healthy habits to help you become successful. And I deal mainly with the emotional and spiritual component, but sometimes that's just not enough. Sometimes there are more extreme circumstances where more drastic treatment is necessary, such as medical intervention to stop cravings and withdrawals, or medication-assisted treatment, or MAT. And that's why I reached out to Dr. Russo, because I want my listeners to know that there are options if you are truly suffering like this. So Dr. Russo, can you please explain or share with us some of your practices and philosophies at Seabrook surrounding this medication-assisted treatment?
Sure. Specific to medication-assisted treatment, there are 3 medications. There's Suboxone, which probably many people have heard of. That is it's an opiate. Okay, it's an opiate, so those are some of the philosophical problems people have taking it. But it's just a partial agonist. In other words, it doesn't turn on the receptor 100%. So it's safer. It's safer, and it's also given as an outpatient. You don't have to go to a clinic every day. You can get prescriptions. They prolong the length of the prescription if you're stable, to the maximum is a month. So you don't have to see a doctor for a month. And it's got a 60% retention rate in treatment. The other one, of course, is Methadone. That's been around since the 60s. It's got a 70% retention rate. It's a full agonist, so it's a little bit more dangerous, and it's highly regulated by the federal government. It has to be given in a clinic. You have to go every day for at least 3 months. Those get extended. If you're there for 2 years, you can have a month take home. But again, there is a problem with that, because there's not only a big convenience problem, you have to go every day, but there's also a social stigma. You're not going to your private doctor's office, you're going to a clinic. But again, it works. It's called harm reduction. We want people to get HIV, endocarditis, infections, get shot in drug deals. So it saves lives. The other medication is Vivitrol, which is a non-agonist. Now there's a blocker, so it blocks all your opiates. We use that for alcohol too, believe it or not, and cocaine to a certain extent. It's tough for opiates because you have to be off all opiates for 10 days, 10 to 14 days before we can give it to you. So that's the danger period. If you're in a rehab for 30 days, which is hard to do nowadays with insurance, okay, we could probably get you started on it. But most of these detoxes that are paid for now, you're taking your last dose of opiate withdrawal medication and you got to go home for 2 weeks to get a shot. High dangerous period. So in an ideal world, yes, the abstinent route with spiritual fitness, strong cognitive behavioral therapy, that's awesome. Sometimes it's difficult to do. I mean, if we had a pill to make your life fantastic, we would give it to you. So as far as harm reduction, if I see a patient come into Seabrook who's had several relapses, maybe had some, significant medical problems, and they just aren't there yet, I would generally suggest maybe considering the medication-assisted treatment with Suboxone for harm reduction. Cuts their cravings, it cuts their withdrawal, so they can focus on their other parts of the recovery. That's where the key comes in. Everyone's different. I try to talk to them, see what they're expecting, what they're gonna expect. At least if they go on MAT, from our standpoint, they can work on weaning themselves down. Once their life is stable, once they have a job, once their wife lets them back in the house, things like that, when they're ready.
Yeah, great points, all of those. And, I want people to understand, because I deal with all types of addicts myself, and everything from drugs and alcohol to food and to, cigarettes, all different types of sex, money, spending, whatever it is. But I want people to know that it's like something like this medically assisted treatment. It's not a substitute for growing. It's a supplement to it all, to your recovery. It's like this part is assisting you going to the next level. And I think a common misconception for a lot of people is like, I'm just going to stop doing these drugs or harmful behaviors and my life's just going to turn around. And that's not how it works. And it takes a little time, right? I say it's 100 miles into the woods, it's 100 miles back out. 100 miles on the way out doesn't have to be as painful or take as long. When you've seen people fail or not be successful and throughout these processes, what do you think some of the reasons were that they were not successful?
You know what? It's the same stuff. People, places, and things. Hungry, angry, lonely, tired. It's the same stuff. It's just, I think, with the medications, they may have a little bit of an edge to fight it off a little bit, to maintain that clarity of thought, maybe. But it's still the same thing. It's just a matter of percentages. They'll have a lower percentage of succumbing to the stuff the rest of us have, succumbed to.
Right. And I wrote a book, it's called Funky Wisdom, A Practical Guide to Life. And in my book, I've talked about something that you probably heard of since you're in recovery, is the how approach to everything. And I really went into detail about it, but it's like, how do I become successful? How do I stop doing drugs or drinking or whatever? And it's HOW, it's honesty, open-mindedness, and willingness. Once I become honest and say there's a problem, now I can fix the problem. And then I become open to new ways of thinking and doing things, and then willing to make changes. And I think in your case, or what you were talking about is people, there is no magic pill. And I think that people aren't willing yet to do what it takes. We say you only have to change one thing, and that's everything. Like, it's good that you can go in and get that type of medically assisted treatment, but there needs to be growth in addition to that. And Seabrook is a great place for that. And can you talk a little bit more about Seabrook in addition to the medically assisted treatments? What else is going on over at Seabrook?
Well, it's 12-step base, certainly. I know some people have a problem with that, but we are. We have a detox unit for people just to come for detox, but we always try to link them with care for their post-discharge. So even if they're here for 7 days, in fact, we're opening a new unit just for detox where they will get intensive cognitive behavioral therapy, 12-step introduction, so that they're not in the general population of people that are here for 28 days, which is a little less intense. We have them in a separate building so we can really concentrate on them because, frankly, if they're just getting detoxed and nothing else, they're generally going to relapse. We're introducing that in a couple weeks. So that's going to be an improvement. We have some outpatient IOPs, one in Cherry Hill, We have some, which does medication-assisted treatment. We have a long-term facility on our campus here in Bridgeton as well. Here they have a lot of interesting things like a wellness center where we do acupuncture, massage therapy, really cool stuff like that, because a lot of people we have is chronic pain is often a pretty not insignificant number of opiate people have chronic pain, which is how they got on the opiates in the first place. So that's always a big problem. How do we treat their pain and treat their opiate use disorder? We're kind of limited. So there's some holistic methods we use to do that, and patients seem to enjoy it.
If you don't mind me asking, what are some of those holistic methods?
Acupuncture, massage therapy, yoga. So we all have specialized people to do that. We also have specialized therapy too, like EMDR, that takes additional training, the eye movement integration, which, for like PTSD, it's really the only, one of the few things that work. We really don't have great medications for it. So we try to get as many modalities as possible in to help us.
Interesting. Yeah, and I love the holistic approaches to things. I think keeping it as natural as possible is always the best bet, because that's, the chemicals and the outside sources are what leads to the problems. So if we could find those healthier ways.
Yeah, and as alcoholics and addicts, we want the pill. Make us feel good now.
Yeah.
And so it's, patients have to understand, normal people, if they have pain or if something's going on, they don't expect a pill, so that's kind of a mindset we have to work on a little bit. One thing about the MAT I just want to throw in also is that the Suboxone works great for pain. So if I have a patient who has chronic pain, refractory to all the other non-medication modalities, like they've had the spinal injections and they've had yoga, they have everything, and nothing works, and they have opiate use disorder, Suboxone will treat both disorders safely. So, that's the one thing I think we can offer people with chronic pain.
Now, for these, the Suboxone, I'm not familiar. That wasn't part of my story. The heroin or opiates and those types of addictions weren't part of my story. But do you see people that get addicted to those? And what's the length of time that they're allowed to use those before we have to stop giving them?
Well, it's up to the patient. There's no set length of time. There is some evidence to suggest that greater than a year is a better prognosis. But if they want to take it for the rest of their lives, that's fine. And so then we have to look at the diagnosis of a substance use disorder. It's all behavioral. 10 of the diagnostic criteria, according to DSM-5, are behavioral. So yeah, they're physically dependent on this medication, no question, but they're not thrown out of the house by the wife. They didn't lose their job. They didn't get DUIs. They're not putting themselves in dangerous situations. All these behavioral diagnostic criteria, they don't fit anymore. Now they fit one, like craving, but maybe withdrawal. So they're two. So yeah, they're physically dependent on it. But their life is better, and they don't we call them in remission. If they have opiate use disorder and they've been on Suboxone for 6 months, their opiate use disorder in remission. And then it's a matter of when they want to come off of it. If they want to come off of it, they have to be weaned down. And it's a little uncomfortable, but I think if they're spiritually fit and they're really heavily involved in recovery, then it can be done. I have to say, in my personal experience, the Methadone's a little bit easier to wean down because of the dosing. We can give 1 milligram. It's in a liquid, so we can titrate from 60, dropping down to 0, 1 milligram a week, or something almost imperceptible to the patient. The Suboxone's a little bit different. If the average dose is 16 milligrams, so it's hard to go down from 16 to 0 without breaking the tablets up. So if they do want to come off the Suboxone and they're not able to do it, you can get them down to like 2 milligrams, and it gets a little rough. I say, why don't you go for a week residential detox? We can give you comfort medications, treat your other symptoms that you're getting, and then it's a little bit easier.
What are the common addictions that you're using these drugs for? So I would assume it's heroin, opiates, or painkillers, or whatever like that, and maybe alcohol in some cases. I don't know.
Yeah, we use, for alcohol, we do use Vivitrol, which is naloxone. Now, we use it for opiates too, but that's the one that we have a hard time is they got to wait 10 days after. Remember, we talked about that. So we would give patients to wake up in the field, like if they had an overdose. Give them, it's Narcan based. It's a form of Narcan. Blocks all the opioid receptors in your brain instantaneously. It's kind of like that. I'll talk about the opiates in a minute with that. But with alcohol, it works for alcohol very well. And the reason why is when we drink, it releases our natural endorphins in our brain, which are natural opiates, which is why we get euphoric when we drink. I mean, you still drink, you get like sloppy, but you don't get that euphoria. So it cuts down the interest that you have in drinking. And it significantly, 60% of people will say that their cravings go away. So it works for alcohol. It's given in a shot form once a month. It's also given in a pill form, which you have to take once a day, which doesn't show any statistical improvement in alcohol outcomes. Because, alcoholics are going to drink today. We're not taking that pill. So we do recommend the shot. It's once a month. And for the alcohol, it's not a big deal because we can start that as soon as they get into rehab. So, we start out with the pill form just to make sure there's no side effects. And they're very minor side effects. They're like some insomnia, belly pain. It generally goes away in a few days. So we start them on the oral form, and then before they leave, we give them the shot. And then we make sure they're linked to therapy afterwards, that they have a provider. And a lot of providers out there will give it, who will give them the shot, follow-up shot. We recommend 6 months to a year. For the opiates, if you can get them on it, it's ideal because it really dramatically lowers their overdose rate.
One of the things we talk about, and I used to go to a 12-step program a lot, and again, I don't think there's like a one size fits all. Some people that works for, some people just go to church and find Jesus and they're all, I mean, there's different ways of doing things. And so if you can share like some of your thoughts or your experience, strength, and hope with people about that are struggling, that are listening to this, that are sitting there at home or wherever watching this, that are just have lost hope and they're just bankrupt. Like me, I was just bankrupt physically, spiritually, emotionally, financially. My whole life was bankrupt and I had nowhere to turn, nowhere to go. What messages of hope and strength can you share with those people? Let them know that there is a way out.
Yeah, well, I mean, I had the same circumstances. I lost my medical license. I had an interview with the Attorney General of Pennsylvania because of my writing prescriptions for myself, and I didn't even know who he was until I watched on TV. 2 weeks later, he's on TV. He's running for governor. I'm like, uh-oh. He's the Attorney General. I'm in a little trouble here.
Yeah.
But, it was simple. I do what my sponsor told me. I went to meetings. Things worked out for me. So, yeah, I lost everything. I lost all my savings. I lost my house, my wife, my career. And it took me a while to get it back. It took me 5 years to get everything back. I mean, I'm kind of a 12-step guy because that's where I got my peace. And I'm not a big book thumper or anything like that. But what it did was it gave me a framework to mature as a human, as I should have done when I was 8 years old. The stuff they teach you in that book, it's like, why didn't someone teach me that when I was a kid?
There was a meeting I used to go to in this old timer. He used to say, "Welcome to kindergarten."
Yeah, it's so true. I grew up with absolutely no serenity, no peace for various reasons. I was an alcoholic when I was born. I had that thinking when I was born. Just me, but those 12 steps and the AA fellowship gave me some sort of peace. It certainly helped me. It made me what I am today. I think I'm a much, better adjusted person, and I can be a normal father and a normal husband and a normal doctor. So yeah, I mean, I was being dishonest with myself. I thought that was normal behavior, but it's not.
Yeah, and I really appreciate that because I think, in my opinion, this was the best part of the interview because this is where people can see that we've all been damaged, we've all been broken, and that's the human condition. I think we all have to go through stuff. I don't think you get to be 25, 30 years old with having been through something, and you have to learn how to overcome it and learn how to feel and learn how to get through things. Because I never did that. I have this analogy that I've been using recently. It's because I'm going through a separation and it's been awful. In the last 2 months, I've been sober 17 years right now. And the last 2 months have been the hardest of my life. I'm already out the other side of like the real pain, the bleeding heartache pain. The way I've been talking about it is It's like if you have these feelings coming into your head, the feelings of resentment, anger, fear, sadness, insecurity, whatever you're feeling today, or even happy feelings. Like I was overwhelmed with every type of feeling. And if they come into my head and then I kind of process them, I feel them, and then they kind of just come out the other side. The
Yeah.
problem with addiction, I think, in my opinion, is like it comes in here, you know, the happy, mad, glad, sad, resentment, fear, insecure, anger, and they get in my head and I don't process them. But instead I go out and I drink or do drugs or smoke weed or eat or whatever I'm doing to numb out those feelings instead of processing them. And then they get stuck inside, they never come out, and they make me sick. And I think that, you know, in the last 2 months, I've been able to feel every feeling that's been coming through me, like the real heartache, the crying, the sadness. And the first like 10 days, I cried every 5 minutes. It's been really awful. And now that's gone. And now, you know, I get these waves of sadness. And then when they come in, I feel them and I process them. And then I just go about my day. And so I think that's what happens with sobriety is recovery from addictions, whatever it is like that's new to us. You were saying, like, I should have learned this stuff when I was 8 years old. And my sister, when I was a teenager, and my sister, who's 3 years younger than me, she was learning things like financial responsibility and dealing with heartache and just growing up at a normal age. And I was like snorting cocaine on a toilet seat in a bar somewhere and thought I had life all figured out. And I would tell people, you should live like this and you should live like that. And they would look at me like, well, your life kind of sucks. So if I do what you're telling me, I'm going to end up like you. But you know what I love is your honesty. I appreciate you as a respected medical professional sitting there saying about the heartaches that you had to deal with and overcome to get to where you are again today. Because I think people need to hear that. We've all made mistakes. We've all failed at things.
You know, there was a study, I think it was by National Institute of Health, said something about like healthcare professionals shouldn't really share their story with their patients. But I have to tell you, I've had nothing but actually positive responses. These people get automatically put at ease. So I do it fairly frequently, and it seems to work for me, you know.
There are certain fields, I think, or maybe certain times, you know, everything's timing. That's one thing you learn in sobriety or growing up, you know, which is what I call sobriety, is just really growing up, looking the world in the eye. Maybe there's times when it's not appropriate to say. But now you know the difference, right? Those are the promises. I will intuitively know how to handle a situation that used to baffle me.
That's a good point, yeah. It's very interesting.
If I'm talking to somebody and it's not appropriate, then I'm not going to bring it up. But other than that, it's like, I don't care.
Yeah, that's a good point. Now, speaking to the one point you had about the way you process things now, you know, that speaks to some of the disease model of this problem. You know, what we do is, you know, we're still kind of governed by our basic instincts, you know, the very remote parts of our brain, which the fight or flight response, which affects us as a kid. You know, many of us are subjected to childhood trauma, which is another big problem with it. So I remember when I was sitting in rehab and they gave me the disease lecture to all of us. And I'm thinking, no, it's not a disease. I'm just a bad person. You know, the disease model is, you know, these pathways are established that kind of connect our more basic, you know, the limbic system, the pleasure center, to our frontal lobes, which is where we process things. So that's why in recovery we have to keep those frontal lobes in good shape to kind of keep those more basic parts of our brain at bay, you know.
Yeah, that's awesome. And I talk about a similar thing, you know, it's the subconscious mind. So our subconscious mind drives most of our actions. And the problem is it's subconscious, it's below our conscious, so it's hard to get to. And the problem is that, you know, if it's driving over 80% of our daily activity and our subconscious mind is skewed because of our beliefs and behaviors, which we developed between the ages of 0 and 18, when our young brains aren't qualified to develop those types of beliefs and behaviors. And then they end up driving the next 30, 40 years of our lives into the ground. And we're like, what happened? I don't know.
Yeah, those pathways are established. You know, our brains don't mature till we're 26. You know, these kids who start drinking when they're 16, those pathways are in there, and they have a little bit harder prognosis, than some people. Now, what's interesting, talking about AA again and the founding fathers, they just observed alcoholics, thousands and thousands, and Dr. Silkworth was fascinated, by alcoholics. And they came up with these things like 90 and 90, okay? They didn't just pull those numbers out. They observed that if someone did that for 90 days, their prognosis was better. And now we can prove with neuroimaging that after 90 days, your brain chemistry changes, and we can show that on imaging. So I just had to throw that out there because it still fascinates me that these guys figured this out. And now we can prove it. 90 and 90 is important for a reason, not only because they said it, but we can prove it scientifically that that's what you should be doing.
Yeah, and I have a program, one of my coaching programs is called the Foundations of Recovery, the Recovery Foundations. And that's about the first 90 days of sobriety. And I include the 12-step program in my therapy. And the reason is because I think you mentioned it earlier, it's the fellowship, right? So I need to change everything about my life. I need to change the places I'm hanging out and the people I'm hanging out with. And all the cliches we hear all the time, you hang out in the barbershop, you're going to get a haircut. That's what happened to me. And so, if I tell you have to change everything and you don't even know where to begin, I'm like, well, if you go to a meeting, you're going to be surrounded by people then they'll give you hugs and take you out for coffee. And, until you figure some stuff out and clear the cobwebs out, it'll give you some really good direction. But most importantly, the fellowship. It's like if I sit here and tell you that every once in a while there's thoughts of suicide that run through my head, or homicide, or I just have like these crazy thoughts about he's behaving wrong or she is, or this going on and this going on. If I walk into Starbucks and start talking to somebody about that, they're like, you're crazy. But if I go to an AA meeting and I sit in the meeting, or NA or CA, whatever your A is, and sit there and talk about these crazy thoughts that go through my head, you look around the room and people nod their head because I'm not alone in my thinking. And that's where you can go get comfort. Because the other thing is, like, my intuitive response to almost everything is to try to, as soon as I get overwhelmed, which doesn't take much, and I get overwhelmed and I get full of fear and insecurity and heartache or whatever my problem of the day is, my intuitive response is to sit in a corner of my house by myself and try to figure it out. And that's what got me sick. That's what got me sick, over drinking, overeating, smoking weed, whatever it was. So now if I can go to a meeting and be in a safe place surrounded by people who understand, that's a better place to be.
Interesting about the fellowship that you bring it up is there's another kind of analogy to caveman days, is that in our Western society, back in the day, people would gather together socially around campfires at the beginning, but there's just more one-on-one interaction. In our Western society, especially now, there is none. So it's kind of going to a campfire, sitting around and telling stories. We have like a basic instinct to do that. So I think even that, from a basic standpoint, makes sense to me.
Yeah, I love it. I really appreciate it. This has been such an awesome talk, and hopefully we could do it again sometime.
Yeah, I'd love to.
I appreciate your time, your expertise in the world of medically assisted treatment, representing Seabrook Treatment Center, and just recovery in general. So do you have any closing thoughts or anything you'd like to share with my funky brain community over here?
No, I really enjoyed it. It was a lot of fun. Thank you for letting me do it.
Awesome. Thank you, Dr. Russo, and thanks everybody for tuning in to the Funky Brain Podcast, and we'll talk to you soon. So you can't think your way into a new way of acting. You have to act your way into a new way of thinking and being. Hi, I'm Dennis Berry, best-selling author, speaker, and life coach for addiction recovery. So many people are stuck in their addiction, whether it's like drugs or alcohol or food or shopping or sex or money, and they think they could just stop or try to figure it out on their own, but they don't change anything in their lives. Nothing changes if nothing changes. In order for change to happen, you have to change something. My clients will be like, oh, I'll stop tomorrow, or if this happens, then I stop, or someday I'll just give it up. And then they just sit around and think, and hope for different or better results, but it doesn't happen. You have to take action. Action most people aren't willing to take. People don't become willing until they're in enough pain, me included. And unfortunately, they wait, and they wait, and time passes by. Even if you are willing, you don't even know where to begin. And that's where I come in. In my best-selling book, Funky Wisdom, A Practical Guide to Life, I talk about the how approach. How do I get sober? How do I stop doing drugs? How do I become healthier? How do I have more successful relationships? How do I become more financially successful? And the answer is how. Honesty, open-mindedness, and willingness. I have to honestly admit that there's a problem. I have to honestly admit that things aren't going well and there needs to be changes. And then once I do that, the door opens and I become open to seeing new ways of living. And then I become willing to make those changes. You can't solve a problem with the same mind that created it. That's why I'm here to help. And, you know, I've been working with clients for over 15 years and helping them get clean and sober and change their lives and achieve inner peace and success. If you or somebody you love is struggling and doesn't know where to begin and how to make those changes to get to where they need to be, give me a call. Not tomorrow or in a week from now when you're hungover and your life is falling apart. Call now. Start making that change today and you'll be glad that you did. I'm sending you love and good vibes. Have a great day today.